Hi everyone, I'm Paige Abbott, and this is your weekly recovery message on the topic of medications in the context of addiction and recovery. The reason that I bring this topic up this week is when I'm meeting with clients who are pursuing recovery, they often come in and are on either one or even a number of medications that they're not aware may be contraindicated for people with addiction. So meaning people are coming in and they're actively pursuing recovery and actively pursuing abstinence with certain substances, maybe drugs or alcohol, meaning non-prescription drugs or alcohol, but they're not paying attention to the other prescribed medication or over-the-counter medication that they may be taking, which may be working at cross purposes with their recovery. Meaning there are many substances that can be prescribed or that are available over the counter that actually exacerbate and activate the addiction circuitry, which then makes that process of recovery and abstinence from other substances that much more difficult. So I am obviously not a trained medical professional. I'm a registered psychologist, so any support around medications that you are on or going to be tapering off of would need to come from a trained medical physician, and ideally one who does have some familiarity with addiction medicine. What I can provide to you today is just a brief list of medications that if you're on any of these medications, you may want to go and have a conversation with that addiction medicine professional just to see if this is the healthiest and safest option for you at this time. So some medications that would be contraindicated or not recommended for people with addiction include benzodiazepines, outside of the context of acute withdrawal. So the most commonly prescribed benzodiazepines include drugs like Xanax, Valium, Ativan, clonazepam. These would be the common ones. There are lots of other ones out there. Many benzodiazepines end in the PAMs or AMs. So if you're on a drug that ends in that kind of lettering, that might be a flag that it is a benzodiazepine. Opioids are medications that do need to be carefully reviewed if those are helpful in the context of recovery. Muscle relaxants, sleep aids. Zopiclone is a very commonly prescribed sleep aid, and Zopiclone really is intended for short-term use, no more than 7 to 10 days, but many clients that we see have been on Zopiclone for months, if not years, and this is a medication that would be important to review if that fits within the context of your recovery. Additional medications to look at that are available over the counter would be decongestants, Benadryl, and Tylenol 1s or T1s. So all of these, again, don't just quit them cold turkey or go off of them, but it is important to look at everything that you're ingesting and putting into your body, because these drugs may be inadvertently activating your addiction circuitry, which will then make the process of recovery a little bit more challenging for you. Around here at HUM, we encourage people to look at addiction as addiction. So this is part of that process, just looking at everything that's going on in your life and starting to evaluate whether it's needed, whether it's necessary, and if it's serving your best health interests. Again, I hope that you can take some of this information to your family doctor or an addiction medicine specialist to get some more specialized feedback on your personal medication needs and where you're at. But it's important to be aware and informed, because these things do fly under the radar, and even doctors who are well-meaning and well-intentioned at times may not have the full information about how these medications are contraindicated for the disease of addiction. I hope this information has been helpful for you, and I wish you the best in your ongoing journey of recovery for the week, and I'll see you next week for the next weekly recovery message. Bye for now.